My name is Cinderella Gasso. I'm a doctor. I'm from Oro Province. I've been working here in Central for the last 7 years. Apart from the work that I do here, I also provide clinical services throughout the district here in Kairuku. Veifa'a Health Center actually comes under the Catholic Church Agency. So we basically look after about 12 other facilities here in the district. Also in Goilala, we look after 4 other facilities. So my work is pretty widespread. Apart from being a full-time doctor here at Veifa'a, I oversee the clinical services run in those facilities, and they're mostly aid posts, health sub-centers, and health centers. As a lone doctor out in a rural area, we need to get a lot of support in terms of online teaching materials, learning materials, and this is provided by the School of Medicine and Health Sciences. It has been able to run this program through the support of the Old Dark Foundation. The Old Dark Foundation is an organization that has helped many rural doctors here in PNG in terms of sourcing medical equipment, and now in terms of assisting with our clinical training as well. However, we have the issue of, it's online studying. How do we get the resources out? So communication also is an issue for us. We have commercial internet services that we use here, but I would say it's not as effective. I remember there are times when I had to go and sit at the top of our tallest buildings. I could just at least send an email, and yeah, it was quite a challenge. I heard about Lightspeed through my senior colleague and mentor, Associate Professor David Mills. He actually, traveled out to see the place and also my struggles, because he has issues with communicating with me as my mentor. And so, when we talked about the best option for accessing the services in terms of teaching materials, we thought Lightspeed is the best option we can consider. With Lightspeed as reliable internet services, I am able to communicate with other colleagues in terms of patient management. As a lone doctor in a rural setting, there are times when I will need a second opinion on how to manage my patients, and so such an internet service will help me relay important patient information to colleagues who can actually give me some feedback on how best to take care of my patients. Also, it helps in the referral pathway. Ideally, if I have to refer a patient into Port Moresby General, I could just quickly send a WhatsApp message to my colleagues at Port Moresby General Hospital in a full, statement, telling them what kind of case it is, and if they could, be there to receive my patients. So such a reliable internet service helps me in the referral pathway.